Let us now see about the caring for families and friends. Caring for the patient who is terminally ill is very important, and it is also important that the family members of the patient who is terminally ill also should be taken care of. They should be given guidance, counseling. They should be their fears surrounding the illness of the patient should be rectified by the people who are taking care of the patient. Care of the relatives and close friends is an integral feature of good palliative care. So it is important that the patient should be taken care of, but at the same time, care should be given to the relatives of the patient and also the close friends of the patient. And it is an integral part of good palliative care system. Meeting with relatives is an essential part of palliative care. So the volunteers, the physician, they have to meet the relatives, and it is an integral part of palliative care. So it can be done at home or in an hospice or hospital palliative care unit. Good care of the patient helps the relatives cope. So when they are assured that the patient is given 100% care, then the relatives will feel that they are taken care of well and they would come out of the disease, right? So it will reassure the relatives, but they also have their own needs. So but these relatives, the family members and the friends, they have their own needs because they have to do their own work, and they have their anxieties, அவங்களுடைய கவலைகள், that must be addressed, like to do with the patient's illness and care. What exactly is wrong with the patient? They should first know what the disease is, what the pathology of the disease is, and what will happen if the disease progresses. So they should know what is wrong with the patient. They should know about the disease condition of the patient and why the patient is receiving certain treatment. So when a blood test is done, when a scan is done, the patient should know about it, and also the family members and the friends should also be told why such diagnostic procedures are carried out in such patient and what will happen next. Now the patient is ill, they are admitted in the hospital, and what is the next stage? Are there any chances of improving or are they going to worse? So they want to know what will happen next. What is the prognosis or life expectancy? So prognosis is they should be able to, they want to know what would happen after 1 month or after 1 year. So they want to know about what would happen in future, or what would happen to their life expectancy, how long will they live, whether his illness is infectious or contagious, right? So some family members or friends, they may be afraid that if the disease is contagious, then they also will get that infection. So they will be afraid of that. So such things should be clarified about visiting in the hospital. So how often can they visit, how long can they stay with the patient, about talking to children, and are the patients allowed to talk to the children, are they allowed to talk to the friends about that particular illness, and how to deal with unsolicited advice from relatives and friends. So once a person is ill, one thing that will make us tired is the different kinds of advice people will pour in. We will never ask for advice, but all the people around us, our neighbors, friends, and all the family members, relatives, they will start giving advice and how to escape from that advice. To do with care at the home, whether they can or should care for the patient at home. So, after the patient comes from the hospital, what kind of care should be given to that particular patient when they are at home? What other people will think about their caring? So, there will be friends around them, there will be relatives around them, and what they will think of the type of care the patient receives at home. What professional help is available? Some people require only some kind of uh, care which could be handled by the family members, but some people require care which can be done only by a nurse. Say, for example, if they have to undergo dialysis, or if they have a wound, a bed sore that has to be frequently dressed, or if they have to take tube feeding. So, all these things the family members may not be able to handle. So, there they will require professional help. How long will they be able to care for the patient at home? Even if the patient comes home, the family members, they will have their own work, their own commitment. How long will they be able to take care of the patient? Whether their health will be adequate, whether the patient who is taking care of the sick person, whether their health will be adequate, right? So when say for example a man is ill, definitely his spouse is going to take care of that man, and that spouse also will be an aged person. So that aged person also will have certain health issues. So will their health permit them to take care of the sick, whether they will cope with any emergencies? So if they have come home and if there is an emergency situation, like they have a breathing difficulty, or if they suddenly faint, or if they have a chest pain, will they be able to handle the emergencies, right? So all these may be the questions that would arise at home, and to do with their own personal feelings and needs. So, as I said earlier, the caretaker's health should be good, and family tensions and how to deal with them. So, when we have a sick person around, we know what are all the problems that will arise in our own home. Even when they are sick for a few days, somebody has a fracture, they have to lie in bed for, say, a week or so, or 10 days. We know what are all the problems that are related to that. So, the family tensions and how to deal with that, and unresolved interpersonal problems from the past, right? So, they might have had a quarrel with their son or daughter or with their wife, and now if that person is sick, how are they going to solve the interpersonal problems and unresolved grief from a recent bereavement? So if they have grief because of a loss that had occurred very recently, what are they going to do? Looking to when the patient dies, whether they have done the right thing, right? How to behave, right? The patient dying is inevitable. They are terminally ill, they are inevitable. But all of us, we want to take care of the patient as long as they live, right? So we will give the utmost importance. So till the end of their life, we will take adequate care, we will give treatment for them, we will stay with them. So whether they have done the right thing. Sometimes what will be told in the hospital is there is no hope of the patient recovering, and therefore they would say that the patient can go home and they can remain with the family members. So they will, when they go home, all the family members will be there. So that itself will give them some comfort before that death. That will give some comfort. So like bringing the patient from the hospital and making them stay at home for that comfort, is it right? Some of them may think. And how to behave after death, and if the patient dies, how are we going to behave, how are we going to react, and how to arrange a funeral. So some of them may know, there are elders in the family, they will take care of that, but some of them may not know how a funeral should be arranged if a person dies, and how will they manage, and how will they manage the death of the person and the things that follows that, where they will live, who will care for them, where will the money come from. These are some of the questions that comes in the that arises when the patient dies, and the legal and the financial matters of the patient. So what can be done? How should these anxieties be addressed? So these anxieties that are present in the family members, relatives, and friends should be addressed. So short meetings with doctor or nurse can be conducted. So to explain everything they want to know about the patient's illness and care. So if they have short meeting with the doctor, if they bother to go and talk to the doctor personally and find out what actually are the health issues, the doctor would welcome that, and they would be happy to explain what actually is the problem with the patient, and to ask questions about the illness, treatment, and the details of what lies ahead. They can ask questions on what the illness is, why the illness is affecting certain parts of the body, and what is the treatment protocol. Everything can be discussed with the doctors, and to ask information about whatever agencies there are to assist their caring. So there are agencies that can have contribute to their management, like we have the health insurance, and there will be some money provided by the insurance agencies for particular illness. So that issues can be discussed with the doctor, and to express their fears about the present and both the immediate and the distant future. So they may be afraid that the patient may complicate or they may die immediately. So all these fears, whatever they have, whatever they think, can be discussed with the doctor. So short meetings with the doctor would help the family members to a great extent, and to talk about their own health and other needs. So they themselves may be a patient. So they first have to take care of themselves, and then only they can offer help to the patient. So they can talk about their own health needs, and they can also express if they have any anger or resentment and sadness about the illness and the care that is given to the patient. So if something is not correct, if somebody is not giving proper care to the patient, right, such things can be discussed with the doctor. The relatives must feel these meetings are solely for them and their problems. And there is here they cannot demand anything from the doctor. இவங்களை சரியாக்கி கொடுக்கணும் அப்படின்லாம் we cannot demand from the doctor, right? So this is just venting or ventilating their feelings. These meetings are just to resolve or understand the dimension of the problem. Most relatives and close friends will appreciate and benefit from these short meetings. So if they discuss with the doctor elaborately and find out what the actual situation is, the doctor will offer counseling to the caregiver of the patient, and the caregiver will now be ready to accept what will come next. The family conferences also would be useful. The family conferences would be useful, and they are necessary for dysfunctional families, or if family tensions are high or there is feuding within the family, right? So the family conferences is talking with all the family members. So where is it necessary? It is necessary when the families are dysfunctional, that is when there are a lot of problems within the family, or when there is a lot of tensions in the family, quarrel within the family. So family conferences would be useful for the patient. These family conferences should be chaired by the doctor along with the nurse and social worker who attend the patient. The purpose of the meeting is explained, and the absolute necessity for all to contribute and to put personal feelings aside. So in the family conference, when all the family members come together, they may have different opinion, they may have had differences of opinion, they might have had a fight between themselves, but everything should be put aside and they have to understand the need for this family conference. The whole family are given details about the patient's illness, about what were the procedures done, what was the investigation, the treatment that is followed, that will be followed, and the prognosis, so what would happen in future. And then they are invited to ask questions. Each family member is then invited to express their feelings, including their anger. So after the doctor briefs them about the procedures that are followed for taking care of the patient, then the family member is allowed to talk to the patient, and they are allowed to express their feelings, including the anger. The doctor can then explain how their anger or feuding is not only helping, is not going to help each of them at this painful time, but also it will affect the final days of their loved ones. So if they're going to have fight, if they're going to have quarrel at this particular point of time, it is not going to help them in any way, and it is not going to give any type of relief to the patient also. They are asked to put their interpersonal differences behind them. So what they may have the differences between the patient who is ill, but that has to be put aside, and they would be advised, or they have to try to love or at least tolerate each other, remembering that each of them is suffering grief, because all the family members will be worried, they'll be pained, they would be undergoing sorrow because of the illness of the patient. They would have disappointments and also apprehensions. So each member has their own grief. So they have to put aside all these interpersonal differences. So when having the family conferences, the family will be asked to appoint one person to be the communication link between the healthcare professionals and the healthcare professionals and the family. So they have to nominate a person who is very responsible to communicate between the family and the doctor. So, how should these anxieties be addressed? At every stage, the palliative care team must ensure that the relatives are being given care. Of course, they give care to the patient, but they also have to look into the needs of the family members. And attention should be given to them, the attention and the time they need. They have to be given proper care, they have to be given proper time, they should understand the apprehensions that are present among the family members also.